So our nursing students have been an exceptional addition to what we're doing here. They have been overseeing much of the logistics in terms of greeting people at the door, doing temperature screening, evaluating recent travel. They've also been doing some swabbing. They have brought wonderful energy to what we're doing. And they've also normalized a lot of the activities that we're going through right now because they're the first people that most of our students see as soon as they show up.
I know that I was here starting, I think I started on Friday, last Friday. And over the other 3 or 4 days that I've been here, we saw a great increase in the amount of students that have been coming. So the first time I was really excited because we got our biggest amount of people, 376, I think. And then the next day that I was here, we topped it. We got up to, I think, over 700 students who came because word of mouth just really spread around the word and everyone was coming in, getting tested. And I think that's really great to see.
I think it's made it a lot easier for a lot of students that have shown up because they're personable, they're explaining what they're doing. We are checking something called Penn Open Pass, which is a daily health questionnaire that does some of that screening for them. And the nursing students have been able to orient them to what it is, get them to use it on their phone and talk about the importance of daily screening. And then when they're inside and they've done the testing, it doesn't seem as intimidating.
I think that just maybe seeing like a familiar face, even though they can just see our eyes, but having like a familiar face be there makes it more normal that everyone should be getting tested if they're coming back to campus anyways.
They do get clinical hours logged, so that goes towards their state board requirements. But more than that, I mean, they're part of what we're all part of right now, right? I mean, a lot of us are familiar with COVID testing, and it's become a part of our everyday life, thinking about these things. And these are nursing students, so we are very much, in the spotlight as nurses because of the pandemic. And this is going to be such an important area for them to know a lot about. We think about nursing as, people who work in the hospital, but it's so much more than that. Our semester hasn't even started yet, and they are already completely on board with helping out.
Even though it's a short procedure, I get to talk to the patients, I get to explain the procedure, and I get to get that like patient care aspect in. And I've also just really enjoyed learning how like student health and how the healthcare workers have adapted to setting up this testing site, because I think it was like very last minute, but it's been so successful so far, and it's like amazing to see how well healthcare workers can adapt in situations that they're not familiar with.
I've been learning so much. I have been having to talk to people and just like really see where they've been coming, helping them feel comfortable even though we only have a few seconds with each person.
The Dean of the School of Nursing early on made a commitment to provide nursing students to support us in any way that we needed over the course of the year. So we were really grateful for that commitment. And without them, I don't know that we would have been nearly as successful in testing the number of students that we've been able to do over the past 10 days that we've been open.